Is it for hot?
Hmm?
Is it for hot?
3.
Three.
Your goals will probably be something like routine C-spine, special C-spine, and then T-spine.
Are we doing this on the table?
Yes, so T-spine we will do on the table. Now, are you able to do the T-spine standing?
Yeah.
Yes, you are allowed to do T-spine standing. However, if you do the T-spine standing, you need to keep in mind that your image will look different from your supine T-spine. And that is because what is affecting the patient when they stand? Sit up. Good. I feel like this was a bad idea. Okay, slide over towards your right a bit, towards the center of the table. Good. Right, not too
The
far. Tiny bit back towards your left.
the C-spine,
Good.
the trauma C-spine we did, it was also 40 inch?
72.
Oh,
or
72.
As long as you can get
Oh,
it.
okay.
So this room doesn't do 72, so just maximize your distance. Table all the way over, tube all the way over. Alright. But what is the difference between an upright T-spine and a supine T-spine?
They're naturally aligned.
Oh, I mean, technically,
Gravity?
yes. Gravity, yes, you can put the arms down by your side. Gravity affects which position?
Upright.
The upright, yes. So when doing the T-spine, you are allowed to do it upright, but you need to keep in mind that gravity will be compressing the spine when you do it upright. Sometimes that's a good thing, sometimes it's not. Sometimes you want to see gravity, sometimes you don't. So it all depends on what you are doing. Okay. Get this nice and lined up. Once this is lined up, I'll try not to touch these anymore. And I will focus on my T-spine right here. So, shoulders down, relax. Great. So I'm gonna do this exactly like a chest. Right, so I'm gonna get my 1.5 inches of light above the shoulder.
Do you need me to move that?
That's okay. I'm gonna get this centering also to the axilla right here. I'm gonna make sure that I am going MSP.
That's good.
Thank you. Okay. So it's exactly like a chest, but with collimation.
Yeah.
That's all a T-spine is. It's a collimated chest X-ray. So you really don't
I
need
just
to
saw
do
that in Smith.
anything fancy. All right. Breathing instructions.
Respira profundo.
Respira profundo.
Triangle.
Y téngalo. Sí, muy bien. Y respire. Normal.
Respire normal.
Right? So, breathing instructions just like the chest as well. You want them to do it on inspiration, diaphragm goes down, right? So spine looks as even as possible. And that's pretty much it. There's not much to say about the T-spine, to be honest. Okay. So far, so good? All right, lateral T-spine. So, patient, if you would please turn so that you're laying down on your left side, yes, face that wall. Good. Do you all remember doing lateral abdomen back in summer 1?
Yeah.
Right? So, similar idea here, right? Similar idea. Let me check here.
What is this? You're looking
But it's at T7.
Okay. So, first first things first. Okay, patient, if you would bring both arms in front of you and fold them like this. There we go.
I just saw this.
Not in front. Okay. Not in front.
You acting like a real patient.
Yes, which is good. We're getting the proper experience here. Okay, so patient is on their side. What is the first thing we should do?
Align them.
Very good. Align our patient. So we stand here at the head of the foot. We look at the patient. Does the MCP look like it's coming straight down the center? Does it look like the hips are too far back, the shoulders are too far back, or does everything look lined up? Do they look lined up to you? So that looks lined up to you?
I
When
think
patient
the
turns around?
shoulders, I think this is too forward.
I agree. I think the hips are too far back, shoulders
Yeah.
are too forward. So try not to move, patient. I'm just going to wiggle you a bit. All right, how's it looking now?
Better.
Better? A little bit more? How's that?
That's good.
Ah, that's a lot better now. Okay, once again, make sure our patient is in true lateral. Okay, so centering, once again, just like your chest lateral. Okay, but with one key difference. So you're still going to be centering here at T7, right? So in fact, I can feel the back here and measure myself down to T7 if I wanted to. But front to back centering, we are no longer going to be at the MCP. And in fact, now that we're doing this, I see that I still need to move the hips. So we are no longer going to be MCP like this. Okay? This is not going to be your T-spine lateral because the T-spine is in which part of the body? Posterior. C-spine curves like this, right? Kyphotic curve here in the back. So we need to center towards the back. So my centering for this is going to be find the back of the patient here. Find the MCP right here, right? So here's the patient's back. Here's the MCP. Right in between the back and the MCP, that is where you center. Does that make sense? So find the patient's back, find the patient's MCP, and you go right in between those two.
Yeah.
That's gonna be, so it's the back half. You're centering on the back half of the body, right? Here's the back. Here's the MCP, which is the middle. So you're centering here on the back half of the body. All right, once again, make sure we have good rotation. Okay, and now we can collimate. Okay. Marker, can put it somewhere here, here, here. Right. So,
It has to be a left marker, right?
left marker, because left side is down. Okay, we're gonna make sure to shield our patient. So the reason why I put the marker here, by the way, is because the spine curves like this, right? Kyphotic curve. So this part I know is going to be free of anatomy, right? If I put it up here, I run the risk of it being where the spine is heading. Put it down here, right? I run the risk of where the spine is heading. Right? Other good spot would be in the back corner here. Now I know normally I say don't put the marker posterior on the lateral, but this is one of the things I'm willing to make an exception for, just because there's no other really good places to mark. Does that make sense? Now, there's a really, really cool thing that you can do with the lateral T-spine. And that is the shield technique. You take a shield, fold it in half, and then you take it and stick it right here behind the patient. And this is used to help improve your image.
How?
It helps to even out the densities. So lots of thick anatomy here in the front and suddenly air in the back. By putting the shield here, you reduce that, you reduce scatter, and it makes the image look nicer. Okay, so it kind of, remember how we talked about the compensating
Filters.
filtration, right? Kind of a similar idea here, right? You have two different densities, right? High density and suddenly low density in the back. By putting this here, it helps to prevent that sudden area of low density, and it also helps to reduce scatter being formed in the back here. Okay, so, really cool trick you can use to kind of optimize your images on a T-spine, lateral T-spine. Now, breathing instructions. Breathing instructions. Now, let's see, if you want to be lazy, if you want to be lazy, what is it? It doesn't say. All right. Okay, so yes, if you want to be lazy, you can do this at the end of expiration. And the idea is that we're trying to empty the air of lungs. Sorry, we're trying to empty the lungs of air so that you don't have so much black superimposing your spine. So the lazy breathing instructions are: take a deep breath in, blow it all the way out, hold it out, don't breathe, don't move. X-ray, you can breathe, you can relax. Right, so AP is on inspiration, lateral is on expiration. However, if you want to create the optimal image, the best image, you're going to use your breathing technique again. Right, so the in and out, right? The he-hoo, right? That's right, he-hoo, right? Just how we go. He-hoo, right? Just in and out. Make the lungs constantly move, right? And by doing that, you're gonna blur the lung markings. And by blurring out the lungs, you will be able to see the spine better.
But why is it different from AP? I mean, should we
Because
blur out the lungs?
Because in AP, the spine is right in between the lungs.
Oh,
In AP, the lungs are on either side, spine's right between, so you don't need to worry about it so much.
so AP inspiration, lateral, shallow breathing.
Shallow breathing. If not shallow breathing, then expiration.
In this picture, did they do a shallow breathing?
I have no idea, but I would guess expiration.
Because you can really see the spine. But it looks like a lateral chest.
Well, maybe check the footnotes. Maybe they'll say something at the bottom. Okay, but that is it. Those are all the projections for this lab section. So you have lateral, along with lateral flexion, lateral extension. You have AP, your AP axial, right, along with the open mouth and the fuchs and the reverse fuchs, the jud. You have your two obliques. And then you have T-spine, AP, lateral, and swimmers. Okay, so those are all the projections that we have for this section.
Lateral.
You're gonna have to put that shield there for a test out.
This one,
Uh-huh.
I'm not gonna require it, but it looks nice.
Bonus points?
I'll talk to Miss Bonilla about it. Maybe we can agree on something. But yeah, that's T-spine, C-spine and T-spine. How does that compare to what you've seen in clinic?